And there have been instances of questionable behavior. These court documents show one insurance company, HealthNet, paid its staff bonuses to cancel policies if clients hadn't correctly declared their full health history, including their accurate weight. One member of staff alone canceled 300 policies. That saved the company $7 million. They praised her vital contribution to their profits. HealthNet argued that the client who sued them hadn't been honest about her medical history. But last year, the court forced the company to pay damages. Jessica Moberly has no insurance either, but at least is covered by one of the government's safety nets, Medicare. She told the doctors here she had 3 types of cancer and can hardly see out of one eye.
Did you have the liver cancer before that child or after, or after?
When she got into the hall, she saw the queues and felt too weak to wait. Eventually, they gave her a wheelchair.
Okay.
You have to be old, disabled, or extraordinarily poor to qualify for state help in Kentucky, so Jessica is relatively lucky to get it. But it's of little comfort. She urgently needs a liver transplant and fears she won't get it.
I'm just 27 and I got 5 kids, and that should be more of the reason for them to help me. I don't know what else to do. I go to my doctor's appointments. And then I'm in misery after I go because I'm sick after I take my treatment. And then I'm not able to do anything, and so I couldn't possibly work to try to get money to pay for it. I don't know what they expect you to do.
Okay.
Jessica pleaded for the doctors here to help her get a liver transplant. But they said she had to go to Tennessee, the state next door, for that. They sent her home with a free pair of glasses, at least.
That's the younger girls.
I really like
it.
All right, here we go.
Jessica says Medicare won't pay for her transport to Tennessee. And she certainly won't get there in this. She wouldn't be in this mess if the private insurance system worked for people like her. America's health insurance companies are proud of what they do. They believe the private health system is efficient and breeds innovation, and say unethical behavior is rare. Much of the health sector says the industry does need reform, but this $2 trillion industry fights for its profits, and Obama sees big trouble ahead.
Making this kind of money costs money, which is why the drug and insurance industries have also spent more than $1 billion on lobbying and campaign contributions over the last 10 years to block the kind of reform we need. They've been pretty good at it, too, preventing the sale of cheaper prescription drugs, defeating attempts to make it harder for insurance companies to deny coverage on the basis of a pre-existing condition.
And already the lines of what could be the biggest battle of Obama's presidency are being drawn. Washington is where laws are made and sometimes unmade.
My most important tool is my staff directory here, all 500.
This is Angela Hunter.
This is my BlackBerry. Never leave home without it.
She's a lobbyist for the health insurance industry.
My mobile phone, God knows you have to be.
She thinks Obama's plans will hurt her clients. So she's working 24/7 to get that message across to Washington's decision makers. Last year, health lobbyists like her spent more than $350 million.
When my computer goes, you might as well cut off my right hand. We plan on mounting a national campaign, and what we hope to do is to, number one, get some articles in the newspaper explaining what the problems are that we see with the plan, to educate lawmakers, people who are members of our organizations, their clients, to go and lobby members of Congress, call them on the phone, visit them in their office, and to just do everything that we can possibly do to preserve the freedom of choice for individuals in healthcare in America.
The lobbyists will descend. What you will see is campaign contributions flowing big, big time. You're running for re-election. We're going to make sure that you get a whole lot of money. And by the way, I'd like to talk to you about some problems that the drug companies are having. These are very, very powerful people with unlimited financial resources, and they know how to use their power.
K Street in Washington is home to the lobbying industry. A powerful $3 billion political machine that's behind American politics. Lobbyists are hired guns. They schmooze politicians, plugging any and every cause. Their pleas are often accompanied by contributions to politicians' election coffers. Lobbying is perfectly legal, highly effective, and many say acceptable. No wonder it's a popular business. This is the Washington National Stadium. It holds 42,000 people. Now imagine this place full 2.5 times over. That is the number of people that work in Washington's lobbying industry.
It's really a system of legalized bribery. As one congressman says, we're the only people in the world who are expected to take money from strangers and provide nothing in return. Of course, they're really not strangers you're taking money from. They're usually, oftentimes, they're former staff people or colleagues that you're taking money from, and you are expected to provide a lot in return.
If Obama is going to have a chance of reforming health care in America, he'll have to do more than take on the industry. He'll have to reform the entire way Washington works, and that is easier said than done. Why? Get this. Out of 535 congressmen here, 533 have received campaign contributions from those in the health sector, including Obama himself. And once you take their money, what happens? Well, take a look at what the world's biggest company once hoped for in return. You weren't meant to see these pictures. This is in-house video of a Walmart corporate conference.
We can do something that's perfectly legal and puts us in the ballgame to compete.
So I want to talk to you about
Here, Walmart executives and lobbyists are raising money from company employees for their Political Action Committee, or PAC, which plugs Walmart's interests in Washington. PACs can make campaign donations to politicians.
Well, what do we do with the money? And let me give you just one quick example. A few weeks ago, Eric and I hosted a breakfast for one of the key senators. We invited 5 or 6 companies that share the same basic business values that we do. You just get that quality time, and that's the way it works.
And what did meetings like this achieve? In 2001, Walmart wanted to fight a bill which was going to give its workers the right to sue them for inadequate health care coverage. In this video, the Walmart lobbyists openly boast about how they got Congress to amend the bill in Walmart's favor.
Because of our PAC, we were able to meet with over 100 members of Congress face-to-face and tell them that what we want is affordable health care. Unfortunately, Congress heard our message, and when the House and Senate passed the Patient Bill of Rights bills a few weeks ago, there are specific provisions covering Walmart that would limit our liability.
It came as no surprise to Washington insider Richard Kirsch.
What they got was the ability to continue to deny their employees health care without being sued by their employees if their employee was harmed by their decision to not give them the care they needed. They put their bottom line in front of their employees' health.
Previously, Walmart has said it had a responsibility to participate in the democratic process, and it's improved health care benefits since. But it wouldn't make any comment to us. And how Walmart influenced Congress wasn't unusual at all.
You have legislation which is hundreds of pages. And there could be one line on page 86 which means an enormous amount to one particular industry, one particular company. And it would be very naive to believe that large corporate interests like Walmart cannot have influence over that process. It happens all of the time.
The most staggering example is what the drugs industry pulled off in Congress in 2003. Politicians and health experts say the pharmaceutical companies effectively wrote part of a law which keeps prices up. The law prevents the government from negotiating lower prices with the drugs industry. Medicine for the uninsured in America is now more expensive than anywhere in the world.
They sell the exact same drugs here in America for double the price of what they charge in Europe and Canada.
Drug prices are high because we're the only country in the world, the United States, that doesn't have the government telling the drug companies what they can charge. The drug companies can charge whatever the market will bear. And because drugs are oftentimes monopoly, there's a huge prices that people can't afford.
Back in Michigan, Debbie and Steve Bowen know what high drugs prices mean in real life. After Steve lost his job, Debbie found out she had cancer. And she can't afford a $75 payment for pills her doctors say she needs to fight it. Debbie's pills cost 6 times more here than in Britain.
When you lie there at night, you know, thinking that there's a $75 pill you could be taking that might be reducing the chances of that reoccurring, how does...
That gets me a little bit mad sometimes, you know.